falsehood. So there are multiple studies in multiple countries, in multiple circumstances, showing the effectiveness of ivermectin. So the question is why? WHO has access to 6 milligram tablets at 2 cents a tablet.
Wow.
Let me say that again. The WHO has access to 6 milligram tablets of ivermectin in their mass distribution program. It costs 2 cents. You cannot make money from ivermectin. However, they will sell you remdesivir. So remdesivir is one of 2 treatments approved for use in the United States of America. It costs $3,000 to $4,000 a course of remdesivir. So this all has to do with money. It has to do with big pharma. It has to do with the influence of big pharma, and that's the bottom line. So why the FDA is now gone completely ballistic is because the legal, now we're talking about legal prescriptions for ivermectin has skyrocketed because people know there's an alternative. So the FDA has done this as a retaliation because of the massive increase in the number of legal prescriptions written for ivermectin. Medical, as long as the doctor has sound medical judgment, it's perfectly legal. They're being influenced by the media, and the media is very powerful. The media is basically controlled by big pharma. And all you have to do is listen to the media, and all you hear about is ivermectin's a toxic drug for humans, it's only for horses. 2.7 billion, that's a B, billion people have been treated with ivermectin. It has one of the safest medication profiles of any drug. They don't tell you the truth. So doctors are misinformed, and I think they're being blindsided by all this government pharmaceutical propaganda. You're right. I mean, if a physician writes a legal prescription and it's the correct dose, the pharmacy really has an obligation to fill it. However, in some states in the US, apparently some pharmacists are allowed to exercise their judgment, whatever that means. So they are refusing. Now, you know, it could be challenged in court, which is a difficult thing. You know, what we suggest is just go to a different pharmacy because, you know, it's a contract between the patient and the doctor. Now, if obviously the physician wrote for the wrong dose or there was a severe drug interaction, then the pharmacist could say, hey, you know what, there's a problem with the script and speak to the physician. But they can't just off the bat refuse. But we know that this is happening, and it's part of the pressure being exerted on pharmacy chains, on pharmacists, not to prescribe a legal drug.
A popular definition of insanity is doing the same thing over and over again, hoping to get a different outcome. Unfortunately, the definition perfectly describes the reaction to the virus that causes COVID-19. So I offer a solution that will break the cycle of insanity that uses fear-mongering, virtue signaling, public shaming, medical misinformation and disinformation, propagandized media, censorship to force compliance with getting vaccinated, and being part of a clinical trial and case study without informed consent. Earlier this year, in June 17th, in a video, Dr. Lee Belliet stated that there are only 5 options for medications and approaches against any infectious disease: reduce infection, reduce spread, reduce symptom severity, reduce hospitalization, reduce death. According to many physicians, the medicines used for early treatment and prophylaxis offer all 5 benefits for these options, whereas vaccines only offer 1 benefit: reduce symptom severity if someone gets sick. Our current approach has not reduced infection, spread, symptom severity, or hospitalization, or even death.
I actually believe that this month, September, may be our highest number of deaths that we've seen throughout the whole pandemic.
And are you aware that many medical facilities and practices are simply sending symptomatic people home without treatment, even if they tested positive, telling them? Are you aware that many medical facilities and practices are simply sending symptomatic people home without treatment, even if they tested positive, telling them to go to the emergency room if their symptoms get too severe? And what results from such lack of early treatment? Well, according to yesterday's evening's KIII 3 News report, the result is an extreme stress level, which is defined as 6% of ICU beds filled with COVID patients. Now, they claim it was from the unvaccinated population, where we all know that vaccinated and vaxxed people are actually coming down, hospitalized, and dying from this disease. That sounds like public shaming and unsubstantiated propaganda. Now, I have 2 personal testimonies that prove
When my daughter and I became symptomatic on August 10th and went to an emergency care facility, the following day my daughter tested positive and I negative, albeit we both had the exact same symptoms. After the medical professional reviewed the protocols that we had taken with us, I asked that we receive the prescription of ivermectin. After stating that ivermectin does not work, they reluctantly prescribed us only 4 days of ivermectin without the other medicines listed in the protocol. The protocol calls for taking it for 5 to 7 days. Being aware of the early treatment protocols, we needed to ask specifically for the prescription, but the emergency care facility did not prescribe the combination of medicines according to the protocols. How many of your constituents are aware of these protocols? Are you aware of these protocols? When I tested positive the following Monday, on August 16, the practitioner refused to prescribe me hydroxychloroquine or ivermectin, again stating that neither worked, but did prescribe me azithromycin and budesonide, which required a nebulizer, the prescription of which was not filled until 2 days later. We were fortunate enough to have a doctor listed among those who treated COVID patients. Consult us later that night. He prescribed us both hydroxychloroquine for 7 days, confirmed the benefit of budesonide, and prescribed me methylprednisolone and ivermectin. Just one more paragraph, please. Without my heavenly Father.
There were only 2 months of clinical trials before the FDA granted emergency use authorization for the 3 COVID-19 shots. Additionally, the FDA forewent the independent panel of experts who normally review safety information prior to authorizing the Pfizer shot. The clinical trials did not include people over 60.
Hold one second.
Mayor, the rules of decorum limit presentations to city-related matters. I don't see how the matters that are being presented about the COVID protocols are city-related at this time.
Mayor, I don't agree with what Miles said. I think we talk about COVID every week.
Okay, what is specifically, because they're talking about
But they're not asking for a city action to occur or not occur.
Right? Mayor, it sounds like they're asking for us to visit with the health director.
You mentioned working with the the county, sir. Is that?
It's up to you, Mayor. I just brought it up.
Right, okay. That's fine. Go ahead.
Social media. I am annoyed because it is difficult to know who to believe when corruption and the love of money and power is so evident. I am annoyed because I cannot be sure that my generation will live in the land of the free that is promised and described so beautifully in our national anthem and constitution. Many doctors, Dr. Vladimir Zelenko, Dr. Simone Gold, Dr. Peter McCullough, Dr. Richard Bartlett, and many others nationally and worldwide have proof that early treatment is more effective than vaccination. Why are we so afraid to try something that has proven to work against this virus? If it were your family members or close friends, wouldn't you want the best treatment plans available? Wouldn't you want them to know as much as possible regarding their health and well-being?
As I mentioned, I received treatment from a medical professional from budesonideworks.com, which consisted of Bioxin, budesonide, vitamin D, vitamin C, zinc, and baby aspirin, which facilitated in the decrease of symptoms and a quick recovery. There are many treatments. There are many treatment prevention protocols such as American Frontline Doctors, COVID-19 Critical Care, My Free Doctor, Dr. Vladimir Zelenko, and Budesonide Works, of which I use, to name a few, which provide treatment and prevention protocols.
Get vaccinated, so while we're hoping we're not coercing them, we're really just trying to give them the information that they need to matter with them. And they are going to drill down to kind of, like block a neighborhood.